Hey, welcome back to Minus Letter Live. My guest this segment is Chris Dobbins. He's the president and CEO of Leap Health, trading on the TSX Venture under the symbol NLH. Chris, thanks for joining us today.
Thanks for having me.
Chris, let's start off with a quick overview. What does Leap do?
We're in the home care services space. So essentially we have caregivers that would go into a person's home and help provide care within the home. So our focus is primarily non-medical, meaning that we would provide services like companionship, light housekeeping, meal prep, transportation, errands, dementia care, and medication reminders.
Oh, so you're perfect for me.
Perfect for you. We also provide some skilled care within our Rhode Island-based business where we would do what we call med pours or changing or the administration of some medication. But primarily we're in the non-medical space.
Right. Okay. So is your business model then to deploy a staff of people who go in and look after people who are requiring those services?
It does. So if you look at the locations that we've acquired over the past year and a half, we're generally buying businesses that have about 75 employees, and the bulk of those employees, about 95% of them, would be in the field or in the home. We also provide care within an assisted living facility or a nursing home where our clients would require one-on-one care. So for example, if there's a dementia client, maybe someone that wanders at certain times of the day, then we would be providing one-on-one care within a facility type setting, but the bulk of our work is directly within their home.
Right. Okay. So this is an alternative for people who don't want to necessarily put their parents in an old age home. They can keep them at home, but bring in some external care to make their quality of life acceptable.
Exactly. So if you look at studies that are out there these days, 85 to 90% of people want to remain in their home.
Right.
Perhaps they've grown up there, they've raised kids there, but ultimately their memories are there, and that's where they feel most comfortable. Occasionally you may have someone for different reasons that has to go into a nursing home, or because they want to be closer to a number of other people, then they'll do that. But the bulk of folks want to remain in their home, and that's the type of care we provide. And it may come directly from a client we're providing care to, or maybe because an adult child is home during, say, Christmas time or whatever special occasion it may be, and they identify that mom or dad needs some help.
Right.
And again, they'll contact us, and that's when we would get engaged to provide the service.
Great. So how does the cost of using your service compare to the cost of actually having somebody live in a later care home?
Yeah, it's a great question. So I want to preface by saying that we're not in what we call the government paid space. So we're in a private pay business, meaning that we would bill our clients on an hourly rate, and they would pay us out of pocket, unless there's some coverage through Department of Veteran Affairs or long-term care insurance. So I think that's the first thing that we have to recognize, is that we're not after Medicare or Medicaid type billing reimbursements. When you compare going into a nursing home or a facility and living there 24 hours a day, the distinction you have to make is that we may be able to provide 10 or 11 hours a week of service within their home so that an individual doesn't have to go to a facility. So it's not really comparing us providing 24/7 care within their home to living in a spot for 24 hours a day, right? So it's really a function of, what's the nature of the service that they require? Is it bathing, personal grooming, some mobility issues? Is it dementia care? We have to make that type of assessment to figure out how much work is required in the home, which again may help someone remain in their home versus going to a facility.
Sure. You reported annualized revenue of $9 million recently, which is amazing, and you seem to be growing through a program of acquisition.
Yeah, so we've been quite focused on acquisitions over the last, really since October of 2016. So we had acquired a very small business there in New Hampshire. September of last year, we acquired a business in Rhode Island. In October in New Hampshire and Vermont. And then more recently in February in Massachusetts, and this past Saturday in another acquisition in Massachusetts. So we've gone from really having a public listing to Now we're at $9 million US revenue run rate. So that's our current run rate. And we've just announced within the last couple of weeks an Eastern Canadian acquisition that we plan on doing, which will take us north of $11 million US as a revenue run rate.
Okay.
Which would also get us to profitability and be cash flow positive. So
great.
this has been a transformational period for us over the course of the last 12 months.
Sure. Okay, what is the scope and scale of the opportunity for this business, North America wide, and then is globally an option as well?
Yeah, globally is certainly an option. I mean, realistically, you think about the baby boom generation, anyone that's been impacted by World War II, if you sort of go back to that point in time. But our focus is really in the U.S. and in Canada, and in particular, we've been focusing in New England in the U.S., so part of the northeastern part of the U.S., and we're about to come into Eastern Canada. So that'll continue to be our focus over the course of the next couple of years. It is one of the fastest growing industries within North America, and primarily because of the demographics and the aging populations. And what's been driving the need for home care in particular has been the prevalence of chronic conditions or long-term conditions.
Right.
And that, for whatever reason, tends to coincide with the age of 65, and as we think about the senior population, and it's usually those folks that we're providing service to within the home. So the home health care segment within the U.S. itself is a $90 billion a year industry for the paid portion of it. The reason I say paid is because we can multiply that by 2 or 3 to factor in the unpaid part of the market, which is really adult children looking after mom or dad in an unpaid capacity. So the market is quite large. It'll continue to be quite large realistically for the next 50 years, just given demographics.
Sure.
And we've been after some smaller, well-established companies, and primarily through a rural type of rollout strategy. So we tend to go into lesser populated areas within the states, and very, very fragmented market. So really no shortage of opportunities, I think, in the coming years.
Sure. In terms of barrier to entry, are the people out in the field conducting these services, are they licensed professionals? What level of sort of professional designation do they require?
It varies. So we would have registered nurses on staff, licensed practical nurses, certified nursing assistants, so you RNs, LPNs, CNAs, and then you have folks that would not have a diploma or certificate within the medical field, but that are terrific as home health aides within the home. So it's really a wide-ranging skill set that we have.
Okay, so then the plan is to continue to grow through acquisition in North America and then consider potentially a global rollout.
Well, certainly our focus for the next several years will be in Canada and the U.S. We will continue to grow, I think, quite rapidly with our acquisition strategy. But once we've made an acquisition within a particular state, where we do see opportunity is the organic growth portion as well. So we'll acquire into a state, and then we'll look at opening new office locations within that state, and that'll form part of the organic growth strategy.
Right.
It's a low risk strategy for us. We can open new office locations without a large capital outlay for a service-based business. And I think that's a model that'll work quite well as we open new locations in the coming years.
Sure, okay. That's a great introduction. We're going to leave it there for now. Thanks so much for coming in today, Chris.
Thanks, appreciate it.
And that's done.